Did you know your hands might be showing signs of a serious lung disease before you ever connect the dots? Lung cancer is especially dangerous because it may grow quietly for a long time, and some of its earliest clues are easy to misread as aging, poor circulation, arthritis, or ordinary nail changes. That is what makes these hand findings important. They are not proof, they are warning signs, and when they persist, they deserve attention before the disease has more time to spread.
Most people think of lung cancer as a disease that always starts with dramatic chest symptoms, but that is exactly why it can slip by. In real life, early lung cancer may cause no obvious symptoms at all, or it may start with vague things like fatigue, a cough that seems harmless, or shortness of breath you blame on age, being out of shape, or a recent cold. And sometimes the body starts sending signals in places that seem completely unrelated to the lungs, especially the fingers and nails. In this video, I want to walk you through 5 hand-related warning signs you should not ignore. These signs do not mean you have lung cancer. Many of them can happen for other reasons. But if they are new, persistent, or happening together, they are exactly the kind of clues that should push you to get checked instead of waiting. And one of these signs especially is so classic that doctors have recognized it for generations.
The danger is not just the cancer itself. The danger is delay. A person notices that the fingertips look different, or that the finger joints ache, or that the nails no longer look quite normal. Then comes the familiar explanation. Too much typing, a touch of arthritis, poor circulation, cold weather. In many cases, the hands are dismissed because they seem too far removed from the lungs. But the body does not organize disease by convenience. A tumor in the chest can trigger blood vessel changes, bone reactions, immune reactions, and oxygen problems that reach all the way to the fingertip.
Let's start with the biggest hand sign of all, finger clubbing. This is the one I most want people to remember. Clubbing means the tips of the fingers slowly become rounder, wider, and more bulb-like, while the nails start curving downward over the fingertips. Early on, the nail bed may feel softer or almost spongy. Later, the whole fingertip can take on that classic drumstick look. This usually happens gradually. So many people do not notice it until the change is already obvious. A simple clue is the little diamond-shaped window that normally appears when you place the same fingers from each hand nail to nail. With clubbing, that window can disappear. Now, clubbing is not specific to lung cancer. It can happen with other lung diseases, heart disease, liver disease, or in some families. But in adults, lung malignancy is one of the most important causes, and it is the most common pulmonary cause doctors think about. So if your nails are curving more, your fingertips are thickening, and this is not how your hands used to look, do not brush it off as cosmetic.
Clubbing has been described in medicine since antiquity because it is visible, physical, and often meaningful. The examination is simple. The angle at the base of the nail becomes flatter and may eventually exceed a straight line. The tissue beneath the nail softens, the fingertip thickens. None of this proves lung cancer by itself. But when an adult develops new clubbing, clinicians are trained to search for an underlying disease, and thoracic disease is high on that list. It is an old sign, but it remains a useful one.
The second sign is a little more subtle, and a lot of people will miss it because it can look like a minor cosmetic change. I'm talking about fingertips or skin around the nails that stay unusually red, puffy, or warm. Sometimes this shows up alongside clubbing, and sometimes it is part of the earlier tissue change before the finger shape becomes dramatic. The reason this can happen is that clubbing is not just a nail problem. It involves changes in blood flow and soft tissue under and around the nail bed. More blood flow and tissue swelling can make the area look more flushed and feel different when you touch it. Now, this is where common sense matters. If one fingertip is suddenly red and hot, that could be infection, injury, or inflammation. But if several fingertips on both hands seem persistently more swollen, more rounded, more warm, or more red than they used to be, especially if the nails are also changing shape, that is a stronger pattern. Think of this as an accessory clue. On its own, it is easy to dismiss. But when it travels with clubbing, it makes the picture harder to ignore.
This is precisely how important signs are overlooked. They do not arrive wearing a label. They arrive looking mild, a little warmth, a little puffiness, a little color change. But in clubbing, increased blood flow and soft tissue change are part of the process, which is why the nail bed may seem springy, swollen, or more vascular than before. The eye is quick to dismiss what the hand could confirm. A careful comparison between both hands and between now and a few months ago often tells the clearer story.
The third sign is pain, swelling, or stiffness in the finger joints or nearby bones. And this is where things get even trickier because it can look so much like ordinary arthritis. Some lung cancers can trigger a condition called hypertrophic osteoarthropathy. That is a long name, but the idea is simple. The cancer can set off changes that affect bones and tissues around the joints, especially in the hands, wrists, ankles, and knees. People may notice aching, puffiness, tenderness, or stiffness with no clear injury. The fingers can feel thick, sore, and strangely tight. Sometimes this comes with clubbing, and sometimes the joint pain is what gets attention first. What makes this important is the pattern. If the pain seems unexplained, if it is happening on both sides, if your fingers look swollen in a way that does not fit your usual arthritis story, or if it appears together with nail changes, that should raise your level of concern. Most hand pain is not cancer, but this particular combination is one doctors take seriously because lung disease, especially lung cancer, is one of the classic causes.
Joint symptoms are dangerous precisely because they seem familiar. An older adult with aching fingers is not likely to fear a lung tumor. They are likely to think of weather, overuse, or arthritis. Yet, hypertrophic osteoarthropathy has long been recognized as one of the chest disease syndromes that can declare itself in the limbs. In secondary forms of this condition, lung disease is the leading category, and lung cancer is the best-known culprit. The hands, in other words, may be reporting a problem that began far above them.
The fourth sign is blue or purple discoloration of the fingernails, or fingertips, what doctors call cyanosis. Healthy nail beds usually look pink. If they start looking dusky, bluish, or persistently gray-purple, especially when you are not cold, that can mean the blood is not carrying enough oxygen. And yes, serious lung disease can do that. This is not unique to lung cancer, of course. Cyanosis can happen with many heart and lung problems, but it is absolutely not something to shrug off. If your body is showing you blue nail beds, that is a sign oxygen delivery may be impaired. On lighter skin, people often notice it in the nails right away. On darker skin, it may be easier to see in the lips, gums, around the eyes, or nail beds, rather than in the skin of the fingers alone. So if you notice a steady bluish change instead of the normal pink color, that deserves prompt medical attention. This is one of those signs where the question is not, could it be nothing? The question is, why am I under-oxygenated enough to look blue? And that is a question worth answering quickly.
Cyanosis is a consequent sign. It tells you less about the exact diagnosis and more about the seriousness of the physiology. Blood low in oxygen changes color, and the tissues reveal it. In long-standing lung or heart disease, cyanosis may develop gradually and be easy to miss. That is why nail beds matter. They can make a quiet oxygen problem visible. Not every blue-looking fingertip means cancer, but no persistent blue nail bed should be waved away as trivial.
The fifth sign is numbness, tingling, burning, or that pins and needles feeling in the fingers that will not quite go away. This one is rarer, but it matters because cancer does not only cause problems by growing locally, sometimes it causes trouble indirectly through what we call paraneoplastic syndromes. In plain English, that means the cancer triggers the immune system or releases signals that end up damaging parts of the nervous system. When peripheral nerves are affected, people can develop pain, altered sensation, burning, or tingling in the hands or feet. Now, I want to be careful here. Most tingling fingers are not from lung cancer. Far more often, the cause is something like nerve compression, diabetes, vitamin issues, circulation problems, or repetitive strain. But when the tingling is persistent, unexplained, happening on both sides, or showing up with the other warning signs we talked about today, it belongs in the conversation, especially because paraneoplastic neurologic symptoms can sometimes begin before the cancer is diagnosed. So if your fingertips feel strange for no good reason and the problem is not going away, do not just keep shaking your hands and hoping it disappears.
Paraneoplastic syndromes are unsettling because the cancer is not always harming the body by direct invasion. Sometimes the body harms itself while reacting to the tumor. In neurologic paraneoplastic disease, immune activity aimed at the cancer can also damage peripheral nerve. Sensory changes, pain, weakness, and coordination problems may appear before the cancer is recognized. These syndromes are rare, but rarity is not irrelevant. Their importance lies in what they may reveal. A malignancy not yet diagnosed.
If there is one sign from this whole video that I would put at the very top of the list, it is clubbing. Why? Because it is visible, it is classic, and once you know what to look for, it can be surprisingly obvious. Look at the fingertips from the side. Do the nails bend down more than they used to? Do the fingertips look thicker and rounder? Does the nail bed feel soft instead of firm? And when you place the same fingers from each hand nail to nail, has that tiny window disappeared? These are the kinds of details that matter. The change usually develops over time, not overnight, which is another reason people miss it. They adapt to their own hands day by day and stop seeing the difference. Also remember this. Clubbing itself is not usually painful. That can fool people into thinking it is harmless. It is not. Even if the cause turns out to be something other than lung cancer, new clubbing in an adult deserves real evaluation. This is not about panicking. It is about refusing to ignore a sign that medicine has taken seriously for a very long time.
Awareness is useful only if it leads to action. The next step is not self-diagnosis. The next step is evaluation. A clinician may compare old and current nail shape, examine the chest and oxygen status, and decide whether imaging is needed. For people at higher risk because of smoking history, screening also matters. Current guidance supports yearly low-dose CT screening for adults aged 50 to 80 who currently smoke or used to smoke and who have at least a 20-pack year history. Screening is not the same as chasing symptoms, but both aim at the same goal, finding disease before time is lost.
So let's bring it all together. The 5 hand-related warning signs I want you to remember are finger clubbing, persistent redness or warmth around changing fingertips, unexplained swelling or aching in the finger joints, blue or purple nail beds, and numbness or tingling that does not make sense. None of these signs by themselves mean you have lung cancer, but they are exactly the kind of body changes that should make you stop, pay attention, and ask whether something deeper is going on. And that matters because lung cancer is often silent early and easier to treat when it is found sooner rather than later. If you notice one of these changes, especially if it is new, persistent, or paired with things like cough, shortness of breath, fatigue, chest discomfort, or weight loss, get it checked. And if you are in a high-risk group because of smoking history, ask whether lung cancer screening with low-dose CT makes sense for you. Your hands may not tell you everything, but sometimes they tell you enough to act before it is too late. If you found this useful, share it with someone you care about, because a small detail on a hand can become a very big clue.